Good morning. This is Dana Parsons, and welcome to the Coronavirus Weekly Member Update. Thank you so much for joining us this morning. Before we get started, I wanted to let everyone know that we have an upcoming assisted living panel discussion on November 6th that I wanted to let everyone know about, that's going to be focusing on best practices for for residents and visitors entering your community, updates on what we are doing, working on guidance related to visitations and assisted living, an update about where we are with assisted living waivers, and specific issues regarding the survey process. So this is going to be a panel discussion with Mary Childs, the Department of Social Services, Teresa Kelsey from Petersburg Home for Landing, and Petersburg Home for Ladies, I'm sorry, and Vonnie Adams from Williamsburg Landing. So registration has closed, but if you're interested in participating, please let us know and we will get you registered for that. You can reach out to Paula and she will get you registered. So we are going to be talking today about planning for the vaccine when it becomes available. So Michael Magner with the Department of Health has joined us to give us an update on that. And then we are going to be talking with Jody Igor from LeadingAge about how you can provide comments on the CMS testing rule. So with that, I'm going to hand it over to Michael. So thank you so much for joining us today, Michael. Over to you. And Michael, you'll have to unmute yourself. If you're on the phone, that'll be *6 or unmute on your computer. Okay, I'm sorry, Michael, we still can't hear you. Paula, could you unmute Michael?
I've been trying.
Okay, Jody, have you joined us?
Dana, Michael's having technical difficulty. He says he's getting no video or sound, just a spinning circle. So Mike, if you can hear us, is it possible to call in from a regular phone, I wonder? Or log off and log back on.
Okay, well, let's see. While Michael's getting prepared and getting online, I am going to see if there are any questions about the update that we sent out yesterday that Michael is going to be talking about. This is where this is the HHS and CDC announcement for the pharmacy partnership. So members who want to participate in this program will have to register the nursing home through the NHSN portal. And for assisted livings that want to participate, you will need to register through the REDCap sign-up form. So any member that's going to be participating, their nursing home or assisted living, you will not have to complete the provider intent form that was sent out. Are there any questions about that? I know yesterday I'd gotten some questions about whether the independent living or other levels of care would need to complete the intent form. And as I understand it from the Department of Health this morning, the clarification we received, if any part of the community intends to administer the vaccine other than the assisted living and the nursing home that will participate in the pharmacy partnership will need to complete the VDH provider intent form. Okay, great. Michelle Ames has said that she's on and she can assist with any pharmacy related questions. I assume this covers all staff and all levels of care. We can get clarification from that when Mike joins us. I believe so, but we can confirm.
Dana, you want to talk about baseball?
I'm really sorry, guys. Sorry we're having these
Oh,
technical
Mike's on the phone.
difficulties.
Rebecca wants to talk about baseball. Mike is on the phone and he can't unmute. Do you see
Sorry.
him, Paula? And what do we do to unmute? *6?
Yes,
I will take this opportunity to let everybody know that legislation was approved in the special session to develop a nursing home visitation protocol. LeadingAge Virginia is serving on a regulatory advisory panel to develop the amendments to regulations that would provide for each nursing home and hospice to develop a nursing home protocol for visitation. So we have some draft recommendations that we've developed to date. We are meeting again this afternoon and we will keep members informed about that. Check your update tomorrow. We'll include the recommendations that we have so far. We are working to make sure that communities have as much discretion as possible regarding indoor and outdoor visits. Okay, would the vaccine be available to all independent living residents as well as those in the health services? So we are getting clarification on that. At this time, the partnership is for the nursing home and the assisted living. So whether the independent living could be included in that, it is a possibility. But at this time, if you do have independent living, please fill out the Department of Health provider intent form. I'll put that link in the chat box. But it is possible that that is what we're seeking clarification about. We've asked the Department of Health to let us know. But at this time, you do need to go ahead and fill out a separate intent form.
Mike, are you there? I see you, Mike. It says you're unmuted.
Did anybody have any questions about the visitation protocol? Okay.
Dana, this is
Yes.
Michelle Ames with Pruitt Pharmacy.
Yeah.
I do have the CDC information about the healthcare personnel. Best I can answer that, and
Yes.
certainly
Great.
we'll let Mike chime in if it's a little bit different. But just to kind of explain how that works, so the kind of the advanced phase of vaccine distribution is separated into two sections, phase 1A and 1B. And 1A is designated for healthcare personnel only. A couple reasons around that, but that we can get into if we have some time. But what the CDC defines is that healthcare personnel for that phase 1A, this is, like I said, just healthcare workers. They consider it all paid and unpaid persons serving in healthcare settings who have the potential for direct or indirect exposure to patients or infectious materials. And they also note that this includes persons not directly involved in patient care, but potentially exposed to infectious agents while working in the healthcare setting. So again, that's phase 1A. So when they talk about that, that is most likely going to be distribution that occurs like at a hospital setting, where any eligible healthcare workers would be able to go and get vaccinated. This phase 1B, which is what the CMS announcement and the HHS announcement was about on Friday. And that's when the vaccination starts to extend to residents in addition to healthcare workers. And the CDC has noted that phase 1B is also going to include non-essential healthcare workers. And so this is, other people who are critical to the infrastructure, who can't work remotely and may also be on site. So, I think when you start talking about your peripheral staff, it's not the patient care, not exposed to infectious agents. They should be, from my understanding, be able to be included in that phase 1B when the pharmacies come to set up your clinics and vaccinate both the workers, the staff, as well as the residents when they get to that particular stage of vaccinations.
Hey, this is Mike. Can you hear me now?
Yes,
There we
great.
go.
Thank you.
Okay. Yeah, that star or pound 6 or whatever it is didn't work. I tried every combination of star and pound and 6 and could not get through. So I apologize for that. I can't see anything on the screen. All I'm getting is the spinning circle. So if
Okay.
you're in the slides, just let me know which slide you're on.
Okay, we're on the COVID-19 vaccine update overview.
Okay. All right, so let's go to the next slide, where you see the graph showing the leveraging pharmacy partnerships.
Yep, we're there.
Okay, so where we're looking at this partnership to occur is during that phase 1A and phase 1B timeframe. You see with the red circle. So this is at the point where vaccine is starting to become available, but it's still pretty scarce and highly prioritized. The idea of phase 1A is all of our frontline healthcare personnel, and then phase 1B is people over the age of 60, people at congregate care settings, and other critical infrastructure workers. So the key point I want to make on this slide, when you look at phase 1A, our staff at our long-term care facilities, including nursing homes and assisted living facilities, would actually be included under phase 1A. However, the residents would not be included until phase 1B. So during that phase 1A, there will be opportunity for staff to get their vaccine either through, the local health departments or through various pharmacies that are going to be handling the vaccine. But it's still going to be pretty scarce. When we get to phase 1B, which will be, a very short time period later, these pharmacy partnerships will kick in. So CVS and Walgreens, as I'll mention, will be available to vaccinate both staff and residents. So if you have, for instance, staff who got their first dose during phase 1A, when these groups come out to your facility during phase 1B, they can also vaccinate any staff for their second dose, plus administer first doses for everyone who has not been vaccinated. So that key window then is during that time frame. If you notice further on in the progression, phase 2, vaccine is considered to be in ample supply that we no longer need to prioritize. We'll continue to vaccinate everybody during phase 2, and I know from the public health standpoint, we're still going to be focused on those priority groups, even though vaccine will be available to everybody who wants it. And then as we get to phase 3, it'll just be a kind of a routine vaccination strategy, the same way we do flu vaccine right now. Will be the COVID vaccine. It's potential that people might need an annual booster, or there just might be a continual need to vaccinate anybody who hasn't been vaccinated yet. But that's to be determined. So if we go to the next slide and we look at our key planning facts and assumptions, the key assumptions are that the 2 doses of the vaccine will be needed, separated by either 21 or 28 days. and that both doses will need to be with the same product. So therefore, we're going to have a plan in place for tracking and for patient reminders to make sure not only do they get their second dose, but they get the second dose of the correct vaccine. And then there are cold chain requirements for the vaccine, particularly the Pfizer vaccine, which will require storage at the -80 or ultra cold storage. It can be stored for a couple of days at the 2 to 8, refrigeration temperature range. But when it's shipped and when it's stored, it's got to stay at that -80. So again, there's a little bit of flexibility for shorter term storage. And if the only product we have is the -80 product, we're probably not going to ship it to long-term care facilities. For one, we don't think that you have the frozen cold storage capacity for that vaccine. And two, the minimum order for that one is about 975 doses. So unless you have a very large facility and you're planning to vaccinate a large number of people, you probably won't get that vaccine. However, there's a way around it through the pharmacy program, as we'll talk about in just a few minutes. The important thing to note is the Advisory Committee on Immunization Practices, or ACIP, is an independent federal advisory committee, and they will actually review the vaccine data and make the final recommended priority groups. So right now, the priority groups that we're working off of are preliminary in nature. And this is subject to really the vaccine safety and efficacy profile, which we won't know until a vaccine has submitted their data for review through the FDA. So once the FDA approves a vaccine, either through full licensure or through emergency use authorization, the ACIP then goes in and reviews the data a second time to determine, who is it safe to give this vaccine to, if anyone, and then who are the recommended priority groups based on the needs of the community, the epidemiology of the disease, and then also the vaccine safety and efficacy profile. One thing to note, again, these are in some of the slide, I apologize, some of the font got covered up by the picture, but this is an independent advisory committee. They're not run by the government. They're made up of, 33 national organizations. And these meetings, they have work group meetings that are private, but their full meetings and votes are open to the public. Their next public meeting is going to be October 28th through 29th. It is unknown whether they will have a specific vaccine candidate to review during that time frame, but they are going to meet to review the information that they have. Next slide, please. So again, when planning for the long-term care facility, I mentioned during phase 1A, long-term care staff would be considered part of that healthcare workforce. And then phase 1B would include those other categories, which also include your residents of your long-term care facilities. Next slide. So when you look at our federal plan, and this is going to be mirrored in our state plan, there are several options for long-term care facilities, and I'll go through each one and talk about them all, briefly, and then kind of go through at the end, and kind of summarize and put my personal recommendation of what to look for in making this choice. But the first line you see is in the white box, the staff only. So this is that phase 1A. If we're in that phase 1A period, and we're only vaccinating staff only, ACIP has recommended that certain populations that are at risk maybe shouldn't get the vaccine because of the safety profile, in which case your staff would just be included with other healthcare providers in the community. And we call this the state allocation. So primarily vaccine would go to state health departments. or other providers that are designated by the health departments to vaccinate our healthcare workforce. And so your staff and employees for your facilities would go to these, either the local health department or these other places where they're designated to get their vaccine, but there wouldn't be an on-site vaccination effort in this case. So that's assuming one role. And then the other role is if there's a recommendation to vaccinate both staff and residents, there are two options. One is on-site vaccination events administered by these federal pharmacy partners, or the facility may elect to do something else. So if you go to slide 9, federal planning staff only phase, this talks about, again, the recommendation from ACIP is only to vaccinate the healthcare providers at the facilities and not the residents themselves. This would kind of be how the allocation would work. So the federal allocations would then be divided up among state allocations, and then the state would start to divide up its allocations among all of these different providers that you see here. So you could send it to Department of Health facilities, as I mentioned. It could also be sent to the occupational health clinics that provide services to all different types of people, like first responders, EMS workers, you know, and then you might have a occupational health clinic that serves your facility. They might go there. Health department may do mobile or mass vaccination events, and that might be another opportunity for your healthcare workers to get their vaccine. So this would all be managed by the state and local health districts. Slide 10 now it starts to look at the other pathways in which both staff and residents are recommended for vaccine. And I'll talk about the one in red first, the facility choice. And this is where vaccination services are provided by pharmacy partners receiving direct federal allocations. So slide 11 just kind of covers that in a little more detail. And the key notes here is that these services would be provided free of charge to both the facility and to the actual staff and residents. So the providers would come in and provide the vaccine and not charge. And again, this would be available to any residents and any staff that have not already been vaccinated or haven't gotten their second dose. And it's an end-to-end management by the pharmacy partner. So they do it all for you. They do the scheduling and coordination with your facility. They order the vaccine. They receive the distribution. They manage the cold chain. They come out to your facility. They do the on-site administration of vaccines. And then they report all the data that's required about the vaccines provided to the states and the CDC. So moving on to slide 12, which is kind of another way of looking at that service. So the retail pharmacy provides both the vaccine and the pharmacist, the personnel to come and provide the vaccinations, as well as all of the supplies needed. And they would show up on day 0 and give dose 1 to everybody in the facility that hasn't been vaccinated yet. And then they would show up 3 to 4 weeks later and give the second dose, plus dose 1 for anybody that got missed the first day. And then they'd show up, you know, on day 42 or 56, depending on the vaccine, for another dose for anybody who has not gotten their second dose yet. And then that's it. So again, it's a pretty easy deal for the long-term care facility because, again, all you have to do is coordinate with the pharmacy. Now moving on to slide 13, talk about the federal planning staff and residents recommended for vaccination, but the facility decides not to use the federal pharmacy program. So moving on to slide 14, if the facility decides they're not going to use the pharmacy, the federal pharmacy partnership, then the facility would be responsible for doing all of these steps. So They'd be responsible for signing a vaccine provider agreement with the state. They would, and this provider agreement, there are several parts to it. One, you have to complete the provider intent form. Your facility has to be set up so that you can report vaccine doses in the Virginia Immunization Information System, or VIS, which many facilities already are. But if you haven't, you'll have to set that up. And then you'll also have to sign the CDC provider agreement form with the state. So there's a 3-step process in registering your facility to receive the vaccine. You'll be responsible for receiving the vaccine doses themselves, maintaining the cold chain, and then administering the vaccine to the residents, and then reporting the data to CDC. The chart on the slide shows all of the data reporting elements that would go into that report. Now, if you're using VIS or VAMS, it'll automatically require you to put all of that data into there. So VAMS is a CDC Vaccine Administration Management System, and VIS is the Virginia Immunization Information System. So there will be 2 options, and you could use either one, but all of these data elements will be recorded for each patient. And again, who are our pharmacy partners? When this slide was first presented by CDC, CVS and Walgreens weren't identified, so they had listed several pharmacy partners that they were looking at setting up agreements both for phase 1 and also for phase 2. Only CVS and Walgreens will be involved in the phase 1B, leveraging the pharmacies to vaccinate long-term care facility residents. So the other pharmacies are also looking to sign agreements with CDC, but they'll be involved more in phase 2 and targeted at vaccinating the general public and not just long-term care. So states may sign up additional pharmacy partners if they would like. That's the other option besides doing it themselves. If they want to work through a BREMO pharmacy or an independent pharmacy that they already have a relationship with, they can do that, provided that local pharmacy has signed an agreement with Virginia in order to do that. So if they already know that their local pharmacy is planning to sign an agreement with LeadingAge, then they can you can use that pharmacy as well. So that's another option. And then last slide, this is how you sign up for your option. For skilled nursing facilities, you have to go to NHSN. All skilled nursing facilities should already have an NHSN account because they have to report their cases and outbreaks of COVID-19 already on a weekly basis. But for assisted living facilities, they have set up an alternate registration for you, and that's through REDCap. And there's the link there. It's redcap.link/LCTF. And again, it's really starting October 19th, so that was 2 days ago. I've been told that it's going to be open for about 2 weeks. And then in November, these pharmacies are going to start contacting you to actually set up the actual vaccination events. One thing I will point out, when you go to these links and indicate your choice, the way the options are laid out are a little bit different than the way I've laid them out in the slide presentation. So you're going to get to select from a drop-down menu, and it's going to read, one option is going to read free on-site clinics held by CVS. Another option is going to read free on-site clinics held by Walgreens. And then a third option will be free on-site clinics held by our existing pharmacy partner if possible. And then the last option is our facility would like to opt out of receiving these services. We plan to receive vaccine and provide vaccination services in another way. So those 4 options, the way they're written, are a little different from what I laid out, but essentially if you want to use the federal partnership, you've got to select either CVS or Walgreens. If you want to use some other method, then you've got to select the other two options. And that's all I have. I'm going to look in the chat to see what questions we have. I'm not seeing any questions. Dana, did you want to have Q&A now, or do you want to save it for the end?
No, I think now would be great. There have been some questions related to if you have other levels of care on your campus, such as independent living or adult day, about what we were emailing about this morning. I didn't know if you wanted to address that. And some questions are appearing in the chat box now.
Okay, so my understanding is that they just have to register their facility. So if their facility has like a mixed use, like you said, nursing home, assisted living facility, is that they only have to go into the NHSN and register. And then when they work with the pharmacy partner, they just need to make sure that the entire population of the facility is included in their vaccination event.
Okay, so they would not have to register the independent living level with a provider intent form?
So, well, the provider intent form is different. So if they're registering to participate in the pharmacy option, then they don't need to complete the provider intent form at all, because the provider intent form is intended for facilities that are going to receive and administer vaccine themselves. So if the facility is going to receive the vaccine and administer their own vaccine internally, then they do need to register through a provider intent form. And if they have multiple locations, they complete one provider intent form, but they list all of the different locations that are going to be included in that provider intent.
Okay, thank you. Okay, there are in the chat box, the NHSN CDC did not ask about staff. However, the red cap asked for the number of staff. Will staff be considered?
Yeah, so staff are considered. I'm not sure why there's a slight difference. It may be because NHSN, you've already got an account with that organization and that system, and they've already got the data somewhere else. But the staff are included with that pharmacy vaccination event.
Any other questions?
Hey, Dana, this is Michelle with Pruitt Health. And I did just want to check with Mike to make sure that this isn't going to be different in Virginia than we're anticipating with any other state, just because it did come across a little differently to me in the presentation, is that for any facility that wants to choose their partner long-term care pharmacy, the way it's been explained to us is that the long-term care pharmacies are going to be under the same obligations as the retail pharmacies. So if, my understanding is that if a facility chooses through this, the sign up, if they select Walgreens, CVS, or their partner pharmacy, their partner pharmacy is going to be providing the same level of service that those retail chains are. They will also be responsible for the storage. They'll fulfill the reporting, provide the administration. It's not like the facility is going to be left up to themselves to figure that out on their own if they partner with their existing long-term care pharmacy. So, Mike, is that going to be any different in Virginia than what it's been explained to us by?
No, that is true. So any local pharmacy that the facility decides to work with will have the same level of service, the same obligations as the CVS and Walgreens. I'm not sure which one is going to get you vaccine faster, because that part of it it's all based on the federal allocation and where vaccines go when they first become available. And if you've got a working relationship with the local pharmacy, I certainly, if you feel more comfortable using them going forward, I would not necessarily hesitate to do so.
Sounds good. Yeah.
Okay.
I'm sorry, Mike. I appreciate that clarification. I just wanted to make sure the facilities understood that, that program is going to be administered the same way without the burden to them, whether they choose their partner pharmacy or the CVS or Walgreens option. That was going to be the same. And I certainly echo your comments that there's so many outstanding questions there and still things to be determined that it's hard to understand what's going to be the deciding factor in which option is going to be the fastest. If you're looking to service from the facility side, there's the question of how it's going to be allocated, but then you also have the issue of your existing long-term care pharmacy services a smaller range of people. You're obviously going to be their priority, which once you enter the CVS and the Walgreens spectrum, how do you know how you're prioritized amongst 15,000 long-term care facilities in the country? So yeah, definitely some questions, and I understand the anxiety and the doubt that comes along with trying to figure out what the best option might be.
Yeah, that's really tough to say, because the federal partners are going to get vaccine off the federal allocation pretty early on, but they're going to be dividing that allocation among all of the states and territories. The local pharmacies are going to be getting their allocation off the state allocation, and of course the state allocation is, dependent on the federal allocation. So, the intent is to try and get vaccine to as many places as quickly as possible. But I can't say that, joining the federal partnership will get you vaccine faster, or joining the state-local partnership will get you vaccine faster, because I really couldn't tell you either way. And I did want to answer the question about whether it's going to be the same in every state. So the federal program is going to be the same no matter what state you're in, but the way that the local option might work in your state might vary a little bit in terms of how the state is registering local pharmacies as part of the state allocation.
Great. We have quite a few questions coming in the chat box. The first one, before these options or instructions were issued, I believe we completed the provider intent form. Will our registration to participate in this override that?
So the provider intent form is for you guys to notify the state if you plan to be, quote, a vaccine provider. So if you, for instance, normally are a provider of other vaccines in your facility, like you do your own flu shots or whatever, and you want to get the COVID vaccine, then you need to register as a COVID vaccine provider. That does not mean that you can't participate in the federal pharmacy program. So, for example, you may want to do both, right? So if you go through the federal partnership, then in phase 1A and B, or really phase B, you can get your whole facility knocked out with the federal pharmacy. But let's say a couple of months later, you want to continue to get, a few vaccine doses to administer to any new residents or staff. You would need to apply for the state provider agreement in order to do that second thing. So, if you're going to receive vaccine and vaccinate, whether it's staff or residents, at any point in the future, then you should probably go ahead and fill out the provider intent form. But that does not mean you can't participate in the CDC pharmacy program. So they're two separate things.
Thank you. Next question. If we choose to use our long-term care pharmacy instead of CVS or Walgreens, will we be delayed receiving vaccine phase 2 instead of phase 1B?
So I really can't answer that question. One of the things that I point out is, we could move into phase 2 before we complete all of our phase 1A and phase 1B vaccinations. It really the start of phase 2 is dependent on the vaccine supply. So we know that vaccine is going to come out in just a few million doses towards the end of the year, but we've got multiple vaccine providers that are ramping up production and expected to have a plentiful supply of vaccine sometime in the first quarter of 2021. So, that the intent is to get you guys the vaccine early as part of phase 1B, but I can't guarantee that we're going to get all of the phase 1B vaccinations completed before we go to phase 2, because the start of phase 2 is really based on vaccine supply, not based on vaccines administered, if that makes sense.
Thank you. Next question. To clarify for a continuing care retirement community or a campus in general, do we include the number of independent living residents in the NHSN sign up or the assisted living sign up?
Say that one again, please.
So for a campus that has independent living, assisted living, and a nursing home, would they include the number of independent living residents in their NHSN sign up and the assisted living sign up, or both? So those independent living residents, where should they be included? In which sign up? One or both?
To be honest, I'm not really sure. I think the intent is to have every facility just do one sign up. So if you're a nursing home, you can sign up in NHSN and include all of your residents at all of your facilities that are located at the same location. But I'll have to get back to you on that. That is, and I think that's almost a facility specific question. So, it depends. Is there just one location and overall management team that does all of the facilities, or are they separate facilities on the same campus with separate are they basically separate entities or one entity? And that's the part that I'm not really sure. I know the intent is for the most efficient method, right? So the most efficient method would be to include you as one facility with all of your residents and to coordinate one vaccination event for everybody. But I'll have to get back to you on that, to be honest.
Yeah, and same question along that. If you have 2 assisted livings on the campus, should they register each assisted living separately? Jody might be able to weigh in on that issue when we have her speak at the end of the call. But we'll definitely get back with everyone on that as we get clarification. Again, did I hear correctly? If you are a continuing care retirement community, you only have to sign up for on-site clinics in the NHSN site. You do not need to repeat in the red cap. We will definitely have to get clarification on that. The next question, will points of contact at Walgreens or CVS be distributed, or should we wait for them to reach out to us? At what point in time will we know if our choice submitted through NHSN was approved?
Yeah, that's a good question also, and I don't have a specific answer for that. And I'm not even sure if there's, quote, an approval process, or if they're just simply everybody who opts in will be included. So good questions. I'll have to get back to you on that one too.
Another question about completing the provider intent form for independent living. Again, we sought clarification from VDH earlier this morning, and the VDH provider intent form should be completed if the community expects to receive, store, and handle or administer and report doses. Is that correct, Mike?
Yes, that is correct. So if the facility is going to be getting vaccine for themselves, they need to be a, quote, provider, and that requires completion of the provider intent form.
The next question, so after day 45 or the third visit by the pharmacy, how does a community continue to get vaccines for new staff and residents? Would this warrant completing the provider intent form?
So it all depends. If your intent is to provide those vaccines going forward, then yes, you should complete the provider intent form. If you have an agreement with the local pharmacy, then the pharmacy would complete that provider intent form. So it really depends on the way that you plan to get vaccine during phase 2 and 3 timeframe.
Okay, I know that there was a comment. Rebecca, I'll reach out to you about signing up if you're having some problems. The next question, if you're choosing to use your own local pharmacy provider to administer the vaccine, would this require an NHSN sign up, or is that only if you choose to use Walgreens or CVS?
So if you're planning to use a local pharmacy, are you required to use the NHSN sign up? The answer is yes. So they want you to go into NHSN and indicate a choice one way or the other. And it's, from what I understand, it's a requirement that all facilities designate their choice before the deadline.
Okay, and I think we might have addressed this one, but the last question, when registering through NHSN, the only question that I was asked is about which pharmacy we preferred. I was not asked about the number of staff or residents. At what point will I be asked to provide this information if I'm going to include independent living and nursing home patients and staff?
Yeah, that's a good question. That's, again, one of those answers I'm going to have to get back to you on.
Okay, great. Well, thank you so much for this. We will be having the recording from today and address all the questions that we get answers to in our update tomorrow. So I thank you so much, Mike, for the update. I want to make sure that we can get over to Jody so that we can get some information about members commenting on the nursing home, CMS nursing home testing rule. Jody, over to you.
Thank you very much. And hello, everybody. And I will just add real quick, because I was listening, you said there were maybe some questions about this vaccine distribution that I could answer. In regards to like registering all of your residents, the total number of residents and things like that, that is something that we've reached out to the program to ask about. We just haven't gotten an answer yet. So we're on it, but we don't have an answer. So with the testing rule, as you guys know, the rule went into effect on September 2nd. However, it is an interim final rule with a comment period, and that comment period closes on November 2nd. And so we encourage everyone to submit comments. You are welcome to submit them on your own, on behalf of your facility, as a group, however you would like to do it. LeadingAge National will be submitting comments, and we encourage you, if you would like to share your comments with us and would like for us to see how we can incorporate those, if you don't feel like sharing them as your own independent person submitting comments, that's fine too. The main topics that we're going to focus on in our comments is, number one, the burden of testing requirements. So what we're hearing a lot about is not providers saying, I don't want to test, or I don't understand why I have to test. It seems like everybody understands the importance of testing. It's just that there's not really a system in place at this point that actually supports you to do that testing. We've gotten the funding, we've gotten some test supplies that have been coming out, but they're really only scratching the surface, especially if this testing needs to continue for months and months and months. So we are talking about the actual financial cost of testing. We're talking about issues with access to supplies, including access to turnaround times, and then also the very real cost of staff time, right? Even if you get the supplies, even if you get the test, you still have to administer those tests, and that takes a significant amount of time away from other duties that you need to be performing in the nursing home. The two major issues, we're not really hearing people talk about the diagnostic testing so much, like if a resident has symptoms or if a staff member has symptoms. The major pain points seem to be around the surveillance testing. That's the one that you're doing the routine staff testing based on county positivity rates. And then the outbreak testing. And in particular with outbreak testing, the concern seems to be about the relatively low threshold for outbreak testing. Now, I will note that CDC is the one who has set that outbreak threshold at one case, one staff member, or one new nursing home onset case. But the concern that we're hearing a lot, which we have shared with CDC already, is that sometimes nursing homes are having to initiate facility-wide outbreak testing of all staff and all residents because they have one staff member who tested positive. It was an asymptomatic person. They were captured in the surveillance testing, but maybe this staff member doesn't have contact with any residents at all. Maybe they don't even have contact, or they have limited contact with other staff, in particular staff who are providing direct care. And so it feels, at least from our non-epidemiological lens, it feels like the exposure risk from that individual is relatively low compared to other exposure risks. And so we will be talking about that in our comments. We're also going to talk about the lack of surveyor testing. You guys might know we sent a letter to CMS Administrator Seema Verma a couple of weeks ago raising concern about this. Some states do require testing of state and federal state surveyors. There's no federal mandate for testing state surveyors, and of course, there's no requirement to test federal surveyors. The answer that we have gotten, because we've brought this issue up with CMS several times throughout the public health emergency, and the response that we've always received from CMS is that surveyors are providing a different type of care, or they have a different type of contact than staff do, which is true in some cases, right? Like your surveyors are probably not providing continence care. They're not necessarily turning and repositioning. However, they are still in resident rooms. They are still moving about resident care areas and going from room to room. They're still interviewing residents. They're still interviewing staff members, and they are still observing care, including a requirement to observe COVID-19 testing if it's available. And so for those reasons, and also the fact that surveyors live in the community just like we do, and they may be living in communities with high positivity rates, we do feel like there is a measure of risk there and a measure of exposure there. And so we'll be including that in our comments. We'll also be talking about the relative burden of reporting requirements. And so if you are conducting your point of care testing, you know that you have these other requirements to report your CLIA requirements, your HHS lab data. We know that NHSN has put the capability or CDC has put the capability into NHSN to allow for reporting your point of care tests through NHSN. However, your state at this point would have to elect for that to be the way that your state, or the way that you are reporting your data to the state, because the federal requirement at this point is that you would be required to report your point of care testing data in a process outlined by the state. We have information that leads us to believe that this will soon change and that there may be a federal requirement related to this. We don't know when it's coming. We don't know what it's going to look like. So we are prepared to include in our comments that we need a more streamlined system for all of the multiple different types of reporting that you all need to do. And then lastly, we're going to talk about the barriers of unnecessary CMPs. This is something that is not specific to COVID. Of course, LeadingAge has been advocating for years about how CMPs are really not the most effective when it comes to quality improvement, right? My personal opinion, punishment is not the best way to change behavior. And so if you as a nursing home are having difficulty with providing care or maybe meeting testing requirements because you don't have enough staff, you don't have the money to hire the staff, you don't have the money to access the tests, how is taking more money away from you in the form of a civil money penalty going to help you, right? That is $1,000 that you could have been using to put toward tests, but you are now having to put it towards the CMP, and that's $1,000 worth of tests that you don't have. So those are the main points that we'll be covering in our comments. Again, I urge everybody to submit comments on the federal rule on their own as an organization, but also please share any concerns, share any ideas that you might have with me about how to make testing more effective, how to more efficiently conduct testing in the nursing home for residents and staff. We welcome all input. If you could get it to me by Friday, and I'll put my email here in the chat box, I'd really appreciate it. We're looking to have our draft completed next week so that we can share it with everyone before submitting to the Federal Register. So that's my wrap on testing, and thank you guys.
Thank you, Jody. Yeah, you can send your comments directly to Jody, or you can also send them to me and I'll compile them and get them to her. So thank you for your advocacy on that. Are there any questions about anything that Jody addressed? Okay. Well, hearing none, I know your time is valuable, so thank you all so much for being on today. Please check out your update tomorrow for clarifications about questions that were raised today regarding the vaccine and the partnership. We'll include all of our updates tomorrow in that. Please reach out to me if you have any questions in the meantime, and our next call is planned for October 28th at 11 o'clock. So thank you so much and have a great rest of your week.